This section is difficult and it's not very fun to learn. It's called counterstrain. The treatment of counterstrain tender points is pretty simple, but knowing the hundreds of different positions and knowing the exact setup for everything gets pretty complicated and pretty convoluted. So in this lecture, I'm going to teach you the high yield stuff that you have to know to get the questions correct using an advanced organizer, and explain to you that maybe you don't necessarily need to remember all of the spots if you remember just to fold and hold. So let's go ahead and start with tender point. So a tender point is what you're going to be treating with counterstrain. A tender point is a hypertonic portion of muscle that is tender when you poke it. It doesn't radiate, it's a tender point. So hypertonic. Now, how do you get a tender point to treat? What happens is you stretch a muscle too fast. An example of this would be you're in a car, you're at a red light, you get rear-ended from behind. And when that happens, your neck extends very quickly and you get the whiplash motion. All the muscles in the front side of your neck are stretching way too fast than what they usually do. This is going to send a signal to your muscle spindle fibers. They're stretching too fast. They're going to get injured if they keep stretching this fast. So there's a reflex arc that says, slow down, contract the muscle. And when that happens, your muscle is then going to contract forcefully. So in our whiplash example, you get hit from behind, extend your neck into whiplash, muscle spindle fibers get activated, tell you to flex your neck forcefully. And now, this is where the tender point will be, the anterior cervical area. Muscles are too contracted. So how do we treat this? When you're doing the treatment, it's very important to follow every single step exactly the same. What they will test you on in an exam is making sure that you're following the steps exactly how they should be. So any counterstrain point, you have to treat it the same. So as we mentioned in the previous lecture, counterstrain is an indirect treatment, meaning that you put it into the freedom, you put it into the position of ease. So in our whiplash example, if the muscles on the anterior side of the neck are flexed and contracted, that means that it is easy for them to flex, but it's very difficult to go back into extension. So if I put it into flexion or into the freedom, that's indirect. So indirect and passive. And again, passive means that the patient does not participate in the treatment. The practitioner is moving them for themselves. So then what? You need to find the tender point, and then you need to poke it and make the pain scale. So you find the tender point on the front of the patient's neck, you push on it, and you ask them, how painful is that? And they're going to tell you it hurts, 10 out of 10, whatever. Whatever they say, you need to tell the patient that during the treatment, that pain that you're feeling right now is going to be considered a 10 out of 10. So the next part is to passively move the patient into the treatment position. Now that you're in this position, you're going to poke the tender point again, and you're going to ask, how painful is it? And they're going to tell you it's decreased. You ask where it is on the pain scale, and if they say it is 3 or less, you know that you're in the correct position for treatment. If they say anything other than 3 or less, you need to readjust your position to make sure that pain is less than 3. Once you're here, you need to hold this position for 90 seconds. Once you hold for 90 seconds, then you can return the patient back to neutral. Once they're back in neutral, you continue to poke on the area and ask, how is it now? Is it still painful? So you're re-screening to see if your treatment worked. An important part of this treatment is to know where you place your finger and when to lift it up. So once that you find the tender point, you poke on the point. You keep your finger on the tender point. Once they give you the pain scale, you keep your finger on the point, but you release pressure, so you're just monitoring. Move them to passive, reassess pain by adding pressure and poking on it. Keep the finger on the point to monitor, hold for 90 seconds, passive to neutral, and then you can rescreen by poking on it. During the entire treatment, you never lift up your finger, you just adjust the pressure that you're putting on it. So now that you know the steps to treatment, we're going to go over some of the high yield points for you to know in the cervical spine, thoracic, lumbar, and ribs. So you have anterior and posterior points. Anterior cervical, anterior thoracic, anterior lumbar, and anterior ribs. And the organizer that we're going to use is going to be SARA. We're going to get really familiar with SARA during this talk. So we're going to write out SR for all of the spots. Now, calling back to the previous lectures, S and R mean side bending and rotation. All that we need to fill in is a directionality for each treatment point. So like I said, we're going to get very familiar with SARA. So any of the anterior cervical points, you're going to side bend away and rotate away. For the thoracic spine, it's going to be a little bit different. So you're going to rotate away, but you're going to side bend towards. For anterior lumbar, you take the thoracic and you flip it. So you got side bend away and rotate towards. And then you got ribs. Ribs are different. They're not part of the cervical, thoracic, or lumbar spine. So they're going to be different than SARA. They're going to be side bend toward, rotate toward. Now what does toward and away mean? Each of these points can be located midline or lateral. When you're treating the lateral points on the right side and you want to side bend away, rotate away, you're going to side bend to the left and rotate to the left. If you want to side bend toward and rotate towards the right, you're going to side bend toward the right, rotate toward the right. That's treatment position. So the last component is the flexion and extension. Well, like I said earlier, fold and hold is going to be the easy way to remember all these. And since this is all anterior, how do you fold up the front? You go into flexion. So these are the basic anterior points for you to know. Now you need to learn the posterior. So you have posterior cervical, posterior thoracic, posterior lumbar, and posterior ribs. For the posterior points, it's important to delineate between midline and lateral points. So cervical, you have a midline point and a lateral point. For thoracic, you have a midline and lateral, but we'll go over midline in a second. So let's just worry about lateral. For lumbar, you have a midline and a lateral. And for ribs, you don't have midline or lateral. So now going back to our SARA mnemonic. She really helps us out a lot for the posterior side because all of them are going to be side bend away, rotate away. The final portion is flexion or extension. So if it's in the back and you want to fold and hold those back muscles, you're going to extend. Now, just like the anterior points and ribs being very different, just like that for posterior, the posterior point is going to be very different. So instead of extension, you're going to go into flexion. So these are all the normal points for the cervical spine, thoracic, lumbar, and for the ribs of the anterior and posterior sides. So going over the organizer again, if it's anterior, you always flex it to fold and hold. For cervical spine, Sarah's our friend. Side bend away, rotate away. For thoracic spine, you side bend towards and rotate away. Lumbar, you flip it, so you side bend away, rotate toward. And ribs are totally different, so you side bend toward, rotate toward. For the posterior points, you always extend, except for ribs, which are weird, they flex. And the rest of them, Sarah is still our friend, so you side bend away and you rotate away. So now you have what we call the maverick points. They don't follow the fold and hold rules very well. So during an exam, it's more likely that you're going to get asked about a maverick point instead of one of these points. These are really easy to memorize, fold and hold. The mavericks take a little bit more memorization. So the first point is going to be anterior cervical 1. This point is located right behind the mandible, up high near the ear, AC1. Now it's AC1. There's only one motion, and it's going to be rotate away. One motion. So don't worry about flexion, don't worry about extension, don't worry about side bending. One motion, rotate away. The next point is going to be AC7. AC7 is located at the sternoclavicular joint, the SC joint. This is where your SCM attaches to your clavicle and sternum. When you think about what motion does the SCM do, it sides bend towards and rotates away to shorten the muscle. So using fold and hold, if you want to shorten that muscle, you're going to do what it does. So you are going to flex, side bend toward, and rotate away. Another way to remember this is that this motion is just like the thoracic spine. Flex, side bend toward, rotate away. If it helps, just remember thoracic spine, -1 vertebra, and now you're at AC7. So flex, side bend toward, rotate away. The next maverick point is going to be anterior thoracic points 1 through 6. Now when you're doing these points, there's only one motion that you need to do. It's located on the anterior side, flex forward. So all you do is flex. No side bending, no rotation, flex. Next you have the anterior lumbar points. You have AL1 and AL5. Now where are these located? These are located on the ASIS and the AIIS. So if you're looking at a picture of where these would be, you can imagine this is the sacrum, this is your hip bone. The ASIS is located up top, and the AIIS is located more inferior. So when I'm palpating these structures, AL1 is going to be located at the ASIS. Point 2 is going to be located medial to the AIIS. Point 3 is lateral, and point 4 is inferior. Point 5 is located on the pubic tubercle. So 1, 2, 3, 4, 5. ASIS, AIIS, pubic tubercle. So going back to how to treat AL1, the position is going to be just like AC7. So you're going to flex, you're going to side bend towards, and you are going to rotate away. So just how one of our organizers was AC7 is thoracic spine minus 1, you can remember AL1 is thoracic spine plus 1. So AL1, flex, side bend toward, rotate away. Then you have AL5, which was located on the pubic tubercle. This treatment position is going to be F, side bend away, and rotate away. I'll let you make up your own mnemonic for that one. So then you have the maverick points for the posterior side. You have posterior cervical point 1 located in the midline. So just like AC1, this midline point of number 1 is going to have one motion, and it's going to be flexion. No side bending, no rotation, just flexion. Maverick point, because since it's on the posterior side and you're thinking of fold and hold, you'd want to extend. But for this point, you flex. Next point is going to be posterior cervical point 3, located in the midline. Now this one, Sarah is going to be your friend again. So F, side bend away, and rotate away. So this is maverick because it's on the posterior side and you want to extend, but in reality you flex. So it's maverick. F, side bend away, rotate away. So then you have posterior thoracic midline points. So all of the points in the midline for posterior thoracic are going to be treated this way. The way that you treat these is extension. You don't do anything else. No rotation, no side bending, just extension. Easy to remember that because it's on the posterior side and you want to shorten the muscles there, you're just going to extend. It's a maverick point because there's no side bending and no rotation. The last point is going to be your posterior rib point for number 1, for rib number 1. The way that you treat this is you are going to put the patient into extension. You're going to side bend away, and you're going to rotate towards. So some of these points you just have to memorize. I don't have a mnemonic for it. So posterior rib point 1, E, side bend away, rotate toward. You just got to memorize it. So we're going to close out this lecture by discussing the difference between tender points and trigger points. They both don't have anything to do with each other than they both start with the letter T, so they can be confused by students very easily. So there's differences between trigger points and tender points. So a tender point is what we've been talking about this entire time. It's a singular point that when you poke it, the pain does not radiate. And the way that you treat a tender point is with counterstrain. A trigger point, which you should be calling a trigger band so that you don't confuse the two with one another, isn't a singular point, but it's an entire band that's tight. And when you poke on this band, the pain will radiate. And when you find a trigger band, you're going to treat it with myofascial, which we will discuss in one of the next lectures. So completely different than the rest of the lecture and doesn't help with counterstrain, but still very important to know the difference between a tender point and a trigger band. So during this lecture, we talked all about counterstrain. We went over what a tender point is, how it starts, the exact treatment order, which you must follow every time, the difference between tender and trigger points, and try to give you an advanced organizer for the cervical, thoracic, lumbar, and rib counterstrain points so you can get this stuff right. And that's Counterstrain.